Thank you for your interest in VetNeuroJar. Although we do our best to summarize veterinary articles, it does not replace the actual article. And if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled Corticosteroid Monotherapy versus Combined Cytarabine Continuous Rate Infusion and Corticosteroid Therapy in Dogs with Meningoencephalitis of Unknown Origin, a blinded, randomized, controlled trial. Abstract. This study compares corticosteroid monotherapy with combined cytarabine continuous rate infusion, CRI, and corticosteroid therapy in dogs diagnosed with meningoencephalitis of unknown origin, MUO. 69 dogs were enrolled in a parallel, blinded, randomized controlled trial. The dogs were divided into two groups. One received corticosteroids alone, and the other received corticosteroids combined with cytarabine CRI. The results showed no significant difference in neurological deterioration rates at 7 days, and no significant difference in clinical deterioration and survival at 30 and 100 days between the two groups. Introduction. Meningoencephalitis of unknown origin, MUO, in dogs encompasses several inflammatory brain diseases that are distinguished histopathologically, including granulomatous meningoencephalitis and necrotizing meningoencephalitis. In AMI, the cause of MUO is unclear, but it is thought to be immune-mediated due to the presence of inflammatory cells and autoantibodies in astrocytes. Treatments aim at immunosuppression using corticosteroids and other immunosuppressive drugs. However, the optimal treatment protocol remains unknown, and the prognosis is still guarded. This study aims to compare the effectiveness of corticosteroid monotherapy versus combined corticosteroid and cytarabine CRI therapy in dogs with MUO. Methods. The study was a randomized, blinded, parallel group-controlled trial. Ethical approval was obtained from the University Ethics Board. Dogs presented to Langford Veterinary Services with suspected MUO were recruited between July 2019 and July 2022. Data collected included signalment, history, physical and neurological examination findings. Inclusion criteria were based on guidelines from a meta-analysis on non-infectious meningoencephalitis. Dogs were randomized into two treatment groups using a smartphone app. Group 1 received dexamethasone monotherapy, while Group 2 received a combined lower dose of dexamethasone and cytarabine CRI. Results. 35 dogs received corticosteroid only, and 34 dogs received the combined treatment. Proportions failing treatment at 7, 30, and 100 days were 20%, 26%, and 43% in the corticosteroid-only group, and 24%, 32%, and 68% in the combined treatment group. There was no significant difference in all-cause mortality at 100 days between the groups. Discussion. The primary aim of this study was to evaluate the efficacy of corticosteroid monotherapy compared to combined treatment of corticosteroids and cytarabine CRI in dogs with MUO. The results showed no significant difference in treatment failure rates or all-cause mortality between the two groups at 7, 30, and 100 days. Several factors could explain the lack of significant difference. First, the study may have been underpowered to detect small differences due to the sample size. Additionally, the heterogeneity of MUO as a disease could have influenced the outcomes, as the response to treatment might vary among different histopathological subtypes. Furthermore, the choice of corticosteroid and cytarabine dosages may have impacted the results. The corticosteroid doses used in the monotherapy group were relatively high, potentially masking any additional benefit from the cytarabine CRI in the combined treatment group. Interestingly, the proportion of dogs experiencing treatment failure increased over time in both groups, highlighting the chronic and relapsing nature of MUO. This finding underscores the need for ongoing management and monitoring in affected dogs. In conclusion, while this study did not find a significant difference between the two treatment protocols, it provides valuable insights into the management of MUO in dogs. Future research with larger sample sizes and longer follow-up periods may help to further elucidate the optimal treatment strategies for this challenging condition. Conclusion. There was no significant difference in outcomes between corticosteroid monotherapy and combined cytarabine CRI and corticosteroid therapy at 7, 30, and 100 days post-diagnosis in dogs with MUO.